what was the treatment, doctor, that you used? Did you use remdesivir? Because a lot of, I remember you telling me earlier this month that remdesivir is having a positive impact. What was the treatment that you used to recover?
Well, with the way we were exposed to the COVID for the last 70 days or so, I decided that I should put myself on rosizulimab, because if I had gone into a COVID storm, then I think I wouldn't have come back. So I took 2 doses of rosizulimab, and we started remdesivir also. And remdesivir I took for 5 days with the first loading dose. As regards to my wife, I did not give her rosizulimab because she was not a candidate. So I had to put her on remdesivir too. And on the 5th day, we turned back, and the day I was leaving, I saw my friend coming in, and I had to take care of him too, which I was doing telephonically.
So doctor, is remdesivir working? Is it working in your view? Is it helping patients? Because
yes.
At the moment in the market, there aren't enough vials. We are told that they will be available by the end of the month. But is it actually working?
Rajdeep, let me tell you something. Ivermectin and doxycycline is also working, but it's working for patients who are not getting critical, who do not require a ventilatory support, or who do not require non-invasive ventilatory support. So ivermectin is also working very well. I prescribed it to patients, and patients are turned around without coming to the hospital.
Can you repeat that medicine? Can you repeat that? Which one is that?
It is called ivermectin, I-V-E-R-M-E-C-T-I-N. Okay. Ivermectin, you take 12 milligrams the first day, the 3rd day, and the 5th day.
Okay.
And along with that, you take tablet doxy, which is 100 milligram, twice a day for 5 days.
Now, in your case, you went to Lilavati obviously because your case was getting serious. But would you advise most people to stay at home and do home quarantine and the same treatment at home?
If the patient does not require oxygen, then I would suggest that everybody should stay at home and take treatment and try to recuperate at home, because the ICU is living hell. Please understand, I've seen both the sides. I've seen myself dying, I've seen myself knocking the door of death, and I've come back. I've seen my wife dying next to me. It is not a blame game, because the staff, they are all tired and fatigued. You can imagine Rajdeep wearing a PPE kit with no water to drink, no tea, no coffee. You cannot even go and urinate for 6 hours. It is so inhuman, yet they are striving their best. The ICU in Lilavati, which has now got 48 beds, you can imagine there are just 2 or 3 boys who can give you a urinal pot or who can give you a commode. Everybody is falling sick. Doctors are falling sick. My request to everybody is that please, for God's sake, don't go gunning after the private institutions with a whip as if the private institutions do not want to treat. Do you know what the private institutions are doing? I have seen it. You are letting the rich, the poor, irrespective of caste, creed, religion, we are treating everybody. And the staff, can I just complete if you don't mind? The staff are tired. I mean, the doctors are tired. The doctors are falling sick. The doctors are dying. So please, for God's sake.
Your point is well taken, doctor. You know, I just want to ask you
though, don't go behind the institutions. We know fully well that the institutions are bleeding. But that doesn't mean that these trustees or the management are not trying to give treatment to everybody.
Let me ask you something more. I want a positive note from you. You are someone who, as you said, you've come back from a very critical situation and you are here on television, and it's great to see you. Would you say that people should not panic, and instead people should realize you can conquer corona and you can come back to win and fight another day? You had any comorbidities, doctor? Did you have a comorbidity situation?
Well, I am a hypertensive and I am a borderline diabetes.
Right.
But that's not the issue. Now let me come to something which is very important, since you have raised this question, and give me some 5 minutes to that. I want everybody to know that we have to live with COVID-19. I want that all the societies where all these people who have elected themselves as secretaries and as chairmen, they sit down in their houses and they talk and they make rules for themselves. Do you know what it is for an elderly couple to be at home alone, where a maid is required just to give them tea, to take them to the toilet, to change their clothes, to give them a bath? What are these people sitting over there and talking about? These people should be put behind bars. We should inform the police and all the authorities, whether they are ministers or whoever they are, the government,
Right.
that these people are the ones who are bringing a rift in society.